Mr. Howell, Bob Howell. So my practice, I took over a practice that was over in Portsmouth, Virginia for about 42 years, Vernon Nicholson's practice. And Bob was one of those, initial patients that I inherited from Dr. Nick. And Bob is maybe one of the most extreme extroverts in the practice, instantly loved the guy. And when I first sat down with him and started talking to him about the condition of some of his teeth, he had had a fall, I think, as a kid, and I remember the teeth had some cracks and older fillings in them. And at that time, we were starting to really delve into some of these newer all-ceramic materials. I still work with the same laboratory that I did all those years ago, Bayview Dental Lab, who actually, my facility's attached to them now. But I remember talking with Buddy and Rick about utilizing this new ceramic material called Empress. And one of his primary goals was if he crowned the teeth, he didn't want to show that metal margin. And he was the first patient that we used these new all ceramics on. But the key is we built these restorations on the occlusal or the bite philosophy that we train other dentists on. And so this philosophy of creating stability and health, why we're working on cosmetic dentistry, is really the cornerstone of what I built my practice and reputation on. So it's very exciting for me to be, now 23, 24 years later, and see work that we put in that at that time was almost looked on as experimental, and see it still lasting. And you think about maybe how many cars he's had in that time period. There's a lot of value for what we did all those years ago.